Good morning. Today on Spotlight, meet two young and very ambitious Southeast Michigan entrepreneurs who are passionately pursuing their dreams and breaking new ground in the city of Detroit and the state of Michigan. My guests, Dr. Paul Thomas of Plum Health and Amina Marhaba of Little Liberia. Independently, they are using their medical and culinary skills to chart a new path. It's Sunday, December the 29th. I'm Chuck Stokes, and this is Spotlight. All right, let me flash you back to 2016. A younger Dr. Thomas had come out of his residency and decided you had a bold idea. What was it?
Yeah, I believe that healthcare should be affordable and accessible for everyone. And that's why I wanted to start Plum Health, to deliver healthcare directly to my patients for a monthly membership, and we don't bill or use insurance at all.
Where'd you get that idea from? When you were sitting in class as a medical student at Wayne State University and then doing your residency after that, is that where it came from, or was this later on or something?
Not at all, because they don't teach you about business in med school or residency. So I worked with some mentors who had started a direct primary care practice in Kansas and one in Denver. I drove out to their practices and I took the best of what they were doing and I brought it back to Detroit, and that's how I started Plum Health.
Did your parents think you were crazy?
A little bit, because my dad grew up working on the assembly line, and he always thought that having the insurance card in your pocket was the gold standard. But as we all know, that's fading. People have $7,000 deductibles and they're paying $100 for a copay to visit a specialist, and healthcare has become really unaffordable for average Americans.
Is the primary health care system in America broken? Because certainly cities and states are building their economies around health care.
Yes, primary care is broken in America. If you pull out your phone and call your doctor's office and you need to be seen today, are you getting in today? Probably not. They're going to send you to an urgent care where you'll have a $300 bill to see somebody for 10 minutes. Or you'll have to go to the ER and have a $2,000 bill to see an ER doctor for 10 or 20 minutes. So we really need to rethink how we pay for primary care, and a membership model, like in the direct primary care model with Plum Health, is a great solution to solve those challenges.
You're headquartered in Corktown?
Yes,
in Detroit, the oldest neighborhood in the city of Detroit?
Yeah, Michigan and Trumbull, right by the old Tiger Stadium ballpark.
So tell me exactly how it works. If I get sick, I go to Plum Health.
Yeah.
Insurance is not an issue here.
That's correct. So you pay a monthly membership, and with that membership, you can call me, text me, email me anytime, and I guarantee a same day or next day appointment when you come see us at Plum Health. And with your membership, we save you 50 to 90% on your meds, labs, or imaging services. Let's say you have bronchitis and you need azithromycin or a Z-Pak. If you went to see your primary care doctor for a same day appointment, they'd send you to the urgent care. All right, that's $300. Then you got to go to the pharmacy, $20 for the medication. With us, you come see us that day. We set you up with the medication. It costs about $1.25 for that same medication. That would be $20 or $30 at the pharmacy.
Dr. Thomas, is this a threat to the insurance system?
It's not a threat to the insurance system, but the costs in the insurance system are so high that many Americans are functionally uninsured. You may get a plan from your employer, but you may have a $7,000 deductible. And by the way, it costs you $150 per paycheck, $200 per paycheck for the pleasure of paying $50 copays and having a $7,000 deductible. That's insanity. So a lot of people have insurance, but they don't have health care. What we offer at Plum Health is that direct health care to our members for an affordable monthly price. Currently, it's $75 a month per person, $140 for a couple, and $200 for a family. We will slightly increase it over time, but that's what it is right now. And then we work with employer groups who are buying health insurance that's going up by 10, 20, 30% year over year, and they're looking to lower their cost structure. So they're adding Plum Health and reworking their health insurance plans to make more cost effective and also just to give better care to their employees.
The major health systems of this area, and they compete against each other, do they view you all as a threat, or are you serving a population they don't really want to serve?
I think there's a few different things there. So we take care of folks who are completely uninsured. So they're disqualified from Medicaid. If you make $17,000 or more in Michigan, you're disqualified from Medicaid. But if you're making $20,000, $30,000, $40,000 a year, you can't necessarily afford insurance. So a lot of those folks buy a Plum Health membership and they get unlimited primary care with us, a trusted doctor that they can see same day or next day. And then we have folks who are uninsured. So they have a health insurance plan, but a $7,000 deductible. And they come and see us because for a known cost, they have comprehensive primary care for themselves and their family members. And so I don't really know what goes in those boardrooms at those big hospitals, but we're on the street, we're on Michigan Avenue, we're in Royal Oak on Woodward Avenue, and we're serving patients in the community that need excellent health care on demand.
All right, we need to take a quick little break. We'll hurry right back with more questions to Dr. Thomas. Stay with us. Dr. Thomas, I first really learned about this. You were making a presentation in front of the Community Foundation for Southeast Michigan. Why an organization like that? I mean, it's a room full of people from all different professions that are really involved in this community. That helps to get the word out in a way you want?
Yeah, I will speak to anybody about direct primary care and about what we do at Plum Health because I truly believe that there's a better way forward for healthcare in America, healthcare in Michigan. People are spending way too much money on healthcare costs, health insurance costs, and this is a way to get better healthcare at a lower cost. Do you know that GM, they spend more on health insurance costs than they do on steel? There's an inflation of cost in the marketplace. So you have to use your insurance typically to buy healthcare services, which is backwards. Everybody has car insurance, but they don't call Geico to put gas in their car or rotate their tires or change the wiper blades. That's like primary care for your car. But in healthcare, we use our health insurance to buy flu shots and get amoxicillin and get a typical preventive wellness visit. We shouldn't be doing that. We should be buying healthcare directly in the marketplace from doctors and clinics, right? And we should be using our health insurance for heart attacks, strokes, hospitalizations, those big things that we use typical insurance for.
And that's why I wanted to clarify, if you have a major health issue, that's something that's not going to be treated at Plum Health. You're going to refer them into the normal big system.
Exactly. We strongly recommend that everybody carries some form of health insurance, but if you want excellent health care where you can text your doctor, email your doctor, and get comprehensive primary care for 90% of your healthcare needs in a year, then you call us at Plum Health.
Dr. Thomas, what's been the biggest success in this venture that you've put together?
The biggest success is that we save people thousands of dollars every single day on their meds, labs, imaging services. We get to take care of a wonderful group of people across Michigan. So we take care of 12 school districts in mid-Michigan, Lansing Public Schools, Van Buren Public Schools, Corunna Public Schools. We get to take care of teachers and school workers and give them excellent primary care. And we get to save people a ton of money on their healthcare costs in a system that feels rigged and overly expensive for typical health insurance.
Biggest challenge you faced?
The biggest challenge that we face is that there's like Blue Cross Blue Shield with essentially a monopoly in Michigan with 65% of the market share on health insurance. And there's no incentive for them to change their ways or restructure insurance to make it more affordable for individuals or families or businesses.
In other states yet?
We are not in other states.
Do you want to be in other states?
We'll see. I mean, we love Michigan. We love taking care of people here. But if there's a call for us to go to another area of the country, we'd certainly look at that.
Would that drastically change the core of what you are about in terms of why you were founded if all of a sudden Indiana came calling and Illinois and other places?
No, we hire a new doctor for every 500 patients that come onto our system. So we keep that ratio of 1 doctor to 500 patients, and that keeps the healthcare excellent. In the typical insurance-based system, 1 doctor has to see 2,500 patients. So So that's why you only get 10 or 15 minutes with your doctor. With the direct primary care model, we keep it perfect. We keep it very smooth because you have a doctor that you can trust that only has 500 patients, and you can get a same-day appointment or a next-day appointment, and you get to spend 30 minutes or an hour with your doctor. And that's our model. That's how we grow.
If you're talking to young medical students trying to figure out their future and they invite you in to talk, what are you going to say to them?
Well, I get invited to Wayne State every year. I get invited to residency programs every year to talk about this compelling model. Medical students want to deliver excellent care to their patients, and they know that it's really hard to do in the insurance-based model because they only have 10 or 15 minutes with each patient, and they're looking for direct primary care options when they graduate so that they can give excellent care and service to their patients, their family members, their church members, their community members in a way that feels good to them. When you bill or use insurance, like insurance-based doctors do, their primary customer is the insurance company. Everything they do is oriented around billing and coding to the insurer to get reimbursement.
And you don't have that headache.
Exactly. When we get paid directly by our patients or by the patient's company, we have one payment come in and we just get to focus on our patient and deliver excellent care and service without any middlemen or barriers or bureaucracy to stop us from giving great care.
All right, Dr. Thomas, thank you so much for coming in.
Thank you.
And best of luck with Plum Health, and Happy New Year to you.
Thank you so much.
All right, and coming up, we'll sit down with a chef about her company called Little Liberia. We'll be right back. Stay with us. And welcome back to Spotlight. Joining me now is Amina Marhaba. She is a chef and the owner of Little Liberia. Welcome to Spotlight.
Thank you so much for
Your
having
first
me.
time on Spotlight.
Yes, it is.
It's good, and almost Happy New Year to you.
Thank you. Happy New Year to you as well.
You're originally from West Africa, correct?
Yes.
Whereabouts, and how did you make the transition to the United States?
Yes, so I'm originally from Liberia, West Africa. Originally, my father brought me and my siblings here for better opportunity and education. And when we immigrated here back in 2010, new immigrant, little to none job opportunities available to me. I was looking for a way to support my family. That's how Little Liberia began. And when I started, even though it started as a necessity, I then saw that cultural need for ethnic cuisine in Detroit, and I continued doing that over the years. And now I'm working towards opening the very first Liberian restaurant in Detroit.
Okay.
Yeah.
Did you speak English as well as you do now when you first got here?
Not as well, because Liberia, we have colloquialism there, so it's not very standard English as it is here. So, there's a language barrier, and I also speak Arabic as well, so I had to, the cultural difference and transition took a while, but we eventually, we fit in and we made it work.
All right.
Yeah.
You have Lebanese in your
Yes.
background as well?
Yes, so my dad was Lebanese and then my mom is Liberian. So I lived both in Liberia and Lebanon. So I have both cultures
You have
and
both roots.
tradition. Yes,
Yeah,
yes.
yeah.
And I'm bringing that into Little Liberia when we open as well.
All right. When did the chef portion come in all of this?
Yeah, so when I always loved cooking in the kitchen with my mom. So in Liberia, she had a little small restaurant in Liberia. So we would go there and help her in the kitchen with the prepping, cleaning, and all of that. And I always loved it, even though it was like a chore, but it felt fun to do. So when I came here and I started Little Liberia, it was like the thing that I loved doing. And as I did it more and more and saw how people accepted the food and they wanted like a burst of that culture here, it just fueled me more to continue doing what I'm doing. And for me, cooking is like not a job, it's like my passion. And
It's
it
fun.
fuels me. It's fun,
Yeah.
yeah. So when I started, I would just go to the bars and just ask them, hey, can I sell a plate of food here? I know how to cook. Can I just sell
Were
a
they
plate of food here?"
receptive?
Some of them were, and thankfully so, because they gave me those opportunities to start. So it was like different bars and restaurants downtown where I would just walk in and ask them if I could sell for the day. And they would say, yeah, sell at the bar, you're bringing us customer, you're selling your food, it's a win-win. So like they gave me that opportunity to do that, and that's how it started. And a year after that, then I started doing the seated dinners where people would pre-buy tickets and then go and have a seated dinner experience.
And
Yeah.
then you do lots of catering and
Yes.
stuff like that.
Yes.
All right. When did you get the idea at some point said, okay, because you talked about wanting to do a food truck at some point.
Yes.
Was that a good idea or bad idea?
It was good in my head, but then when I started doing the research, I found out, like, at the time, opening a food truck would have cost around $50,000. And I'm like, okay, I don't have that money right now. Maybe I need to start doing the pop-ups to save up for the food truck. So the food truck was the original starting point. But then when I started doing the pop-ups, I realized I didn't want a food truck. I wanted a full-on restaurant. And that's when in 2022, I went through the Hatch program. And after winning the Hatch pitch in 2022, I got connected with all these resources through TechTown, Motor City Match, Hatch Detroit, that has been helping me towards the goal of the restaurant.
And how much money did you get when you won the Hatch program?
$100,000.
$100,000.
Yeah.
That probably made you jump for a little jubilation,
Yes,
right?
yes, it was a big win.
And the competition, I hear, was pretty heavy. How many people did you have to beat out?
350 people that year. Yeah, because it came back after COVID. That was 2022 was the first year Hatch came back after it closed down for COVID. So everyone applied, like most businesses in Detroit applied for it. So it's 350 people, and you know, you go down to top 100, top 50, top 25, and then when you get to top 5, you do the big pitch in front of a large audience, and you pitch your business idea to people, and you know, sell your story and why they should support you and why your business is important.
All right.
So,
Which brings me to my next question. We're going to take a quick little break. We'll come back and we'll talk about the restaurant that will actually be a brick and mortar restaurant, where you're going to have that, and what the next chapter is going to be for you.
okay.
All right, we'll be right back right after this. Are there any Liberian restaurants in the city of Detroit?
None.
Not a single one.
Not a single one in the entire Michigan.
Entire
Not even
Michigan, the
just
entire
Detroit.
state.
Yes,
But you're about to change that.
I'm about to change that.
All right, how?
Little Liberia. We're opening our first brick and mortar. We've been doing this for a while, so we have the customers who know the food, who have been trying the food, who love the food. So now I'm ready for that to be a permanent location. So we're going to be opening our first location in the East Warren area, coming up in the fall 2025.
Fall 2025. What will be the benefit to this area when that happens? Because we're talking about the renaissance of Southeast Michigan, particularly the city of Detroit,
Yeah.
and all these restaurants that are popping up everywhere, and all of a sudden we're starting to become a foodie town.
Yeah. I think the first thing that comes to mind would be like the cultural community that we're creating, because a couple of years ago we didn't have this food scene in Detroit like we do now. So we're creating that destination where people could come here and they could have different cultural experiences. And when you think of Liberian, going back to the question of why there isn't a Liberian restaurant, we don't have a big community here. And it's up to us, the little of us that are here, to make that difference. And that's why I feel it's so important that I bring a little bit of Liberia to Detroit through Little Liberia, so people could try the food, experience the culture, and just get a feel of a different community that maybe they might not have experienced somewhere else.
In order to be successful, you're going to have to appeal to a broad sector of the society to say, come in and try us.
Yes, yes. Food is the biggest barrier, and I feel like it's the biggest bridge that you can create between different cultures. Even you can be from 2 different sides of the country, you could all come down and eat the same plate of food. So using the food to be the bridge to create that cultural experience between what we know here in the US and what we know from back home, it's so amazing to me because it's the easiest way to bring people together. And the fact that Detroit has accepted Little Liberia so well over the years, I mean, the competition is the proof of that. People had to vote for us to win. You know, it's not just, you know, as good as you are to go up there and just sell your food. People had to believe in what you were doing, believe in your vision, believe in who you are, and love the food in order
You
to
got to be a
get
pretty
you there.
darn good cook, too.
The food is good.
Let me ask you a bigger question in a sense. Do you think we're finally reaching the time in America, not just in Michigan, in which chefs and food from Africa is finally getting the recognition, in the Mideast, the recognition that it deserves and the history that goes all the way back, but maybe hasn't been marketed to the point in the way that we've done in terms of European cuisine. You've got Baba Fair, which is on Woodward, right at the Boulevard.
Yep.
Who's originally, I think the owner is originally from Burundi.
Yep.
He's had great success. You have Ethiopian restaurants here that have done well. Is the world finally, Michigan, America finally catching up to what the rest of the world has known?
Yes, and I think they're ready for it. And what we're doing now and the exposure that African cuisine and African culture has now in the US shows us that they're ready for this because people are accepting it, they're ready to experience it, and we are ready to share it, you know? So I think there's no better time. This is the right time. This is why it's happening the way that it's happening. And for me, I'm just so happy that I'm able to do that. I'm able to bring this here.
2 quick final questions.
Yeah.
What's your ultimate dream?
Oh, ultimate dream. Little Liberia, become global. The culture is just shared on such a high level that people want to continue to create bridges between diverse community.
And with New Year's Day coming up in just a couple of days, what will Chef Marhaba be fixing for New Year's Day?
Oh, we're gonna have the full Liberian spread from cassava leaf to palm butter to our rice bread. We eat a lot in Liberia, a lot of different food. So on big days like that, we just do all the comfort food and make a big spread and everyone sit around and eat around the table and just be thankful for the year and everything that it brought to us.
All right, you've already made me hungry. Chef, it's a pleasure meeting you, and formally having you on Spotlight. Best of luck with the opening of your new restaurant, and when you have that grand opening, will you let us know so we can get you back?
Of course.
All right.
Thank you so much for having me.
Thank you so much, and best of luck to you.
Thank you.
We'll be back next year to begin the 60th anniversary year of Spotlight on the News. Happy New Year. Good day.